My name's Kim Howard. I'm a civil engineer from Australia. I've worked overseas really in many countries for the last 25 years, but now I'm Australian based. I went to an Australian dentist and they had a very severe prognosis on what to do and also very high cost. So then I started looking at alternatives and particularly wanted to keep my upper teeth. And fortunately that was the solution that was available here. After problems with Australia, I looked online obviously, and I had heard about dental clinics particularly in Thailand and to a lesser extent in Vietnam. So I looked online and one of the attractions was being able to send the x-rays from Australia over to Thailand and get a preliminary diagnosis on that and discuss that and, if necessary, have some changes or reviews done. I wasn't aware of the MALO before I contacted Bangkok Smile, and the issue there was bone graft. I'd had some periodontal and bone loss in my lower jaw and was expecting to have grafts that had to be done and an extended treatment program and much more expensive. So to hear from MALO that that bone grafts were not necessary was a big incentive to come here. Yes, so far it's only been 5 days now, but so far the results are good, and I'm eating and certainly better than before I came, when I had a front implant and bridge, a 2 implant and bridge missing from the front of my lower jaw. So now it feels not too bad, and it's early days. Everything will get much better, I'm sure. Look, the treatment here, the 2 words I'd categorise, it's very professional and very efficient, and they're the 2 things really as a civil engineer that I recognise most. So professional and efficient and very caring as well. The other aspect of any dental work is pain, and the pain has been virtually non-existent during a lot of treatment in upper work and on the MALO work on the bottom. So some discomfort, particularly with the MALO, but no great pain. It was just a matter of quite long surgery time. It's convenient to come here. The location is good. The hotel I'm staying is next door, 1 minute. And work in Australia, for example, I live in the country, and to go to the city in Australia would be travelling several hours each visit. So here it's 1 minute from the hotel, and a comfortable bed and air conditioned and refrigerator, and 1 minute to the clinic. So that's certainly very useful. At home I'm a very keen golfer, and I took the opportunity here, if I've got days off, and I've felt surprisingly healthy and good during this period, and my body is strong, I looked up and there's the David Ledbetter Golf Academy here. So in my days where I haven't got treatments and feeling good, I've been taking the opportunity to have the David Ledbetter instruction while I'm here. So a benefit is teeth fixed and golf swing fixed. So a double. Besides the MALO work has been finished, and there's a temporary plate put in, and that'll be changed in 4 to 6 months. I return, more golf lessons as well when I return, and a permanent metal base plate put in. At that time, there's time for further adjustments as well. So if the bite or your mouth adjusts a little bit, there's a second adjustment opportunity at that time. The other work, I had a lot of work done on my upper teeth to save those, and this was conventional root canal work with caps on it. and some fillings as well, root canals, fillings on the teeth that were affected. But that also has been done very well, and now you certainly feel much better with good teeth.